Bismillahirrahmanirrahim. Good afternoon, everyone. Here is Dr. Imran from Pakistan. Today we talk about teeth issues. First, I want to talk some single homeopathic remedies which we are common used in our clinical practice. In hollow teeth, cold water by least touch in open air, antimonium crodum 30C 3 times a day. Congestive with sore breast filling from cold Epsmelfica 30C 3 times a day. In hollow tooth, but frequently in sound tooth, more than one tooth may be involved. Laying on affected side from pressure of the head against the pillow and cold bryonia 30C 3 times a day. Tearing in the teeth and gums, Canthrus 200C 3 times a day. Cold application relieves for an instant Chamomilla 30C 3 times a day or Chamomilla 200C 3 times a day. With gum boils, swollen cheek, cold drinks, warm application, Lycopodium 30C 3 times a day. Decayed teeth, the pains are tearing and pulsing and shoot into face and ears. Mercurius 200C 3 times a day. Preeminently in hollow teeth, antimonium crodum 200C 3 times a day. Tearing and burning teeth at first become yellow and then dark and decay. Cariazotum 200C 3 times a day. Cold application relieves permanently. Coffea croda 200C 3 times a day. Of children and nervous people in children from decayed teeth, Coffea croda 200C 3 times a day. With swollen gums, throbbing as if suppression had begun in warm room and at night, Pepper sulf 200C 3 times a day. Yellow teeth gums full of blisters. Yellow teeth gums full of blisters. Iodium 30C 3 times a day. With throbbing while eating kali carb 30C 3 times a day. Throbbing pains always come after waking from sleep, after eating also from warm and cold drinks. Gums swollen and blush, are tense and hot and look as if they would crack. Lexis 200C 3 times a day. During pregnancy, when the gastric and hepatic symptoms predominate at night, magnesium carb 200 c 3 times a day. Indicate teeth, cold water, sanguinaria 200 c 3 times a day. Nervous and irritable persons whose teeth decay rapidly, burning pains by motion and talking, cariazotum 200 c 3 times a day, with jumping pain, throbbing pain in evening and in the open air, sulfur 30 c 3 times a day, with the feeling as if a worm in crawling at the root, kali iodide 200 c 3 times a day. Between then during eating, Agnesia Mara 200 c 3 times a day. Pains extend from teeth to the left side of the face, make the patient excitable and nervous, even throw into gum bleed, blood being dark, cariazotum 200 c 3 times a day. Gums dirty with white edge, mercurius 200 c 3 times a day. During pregnancy, at night pains, Rathania 200 c 3 times a day. Teeth hollow and dentine inflamed by warmth of the bed, open air at night. Mercurius 200 c 3 times a day. Nervous pains of head when they go into face and teeth. Pulsatilla nigra 200 c 3 times a day. Gums show fastidious openings, oozing, then offensive Salacia 6x 3 times a day. When associated with EDH, Plantago in 30C 3 times a day. Pressing, tearing pains in the which seem to show through the eyes into the teeth. Zincum metallicum 200C 3 times a day. So now I want to talk some homeopathic remedies for gum bleedings. Soreness of gums bleeding, arnica 200C 3 times a day. Gums swollen and sensitive to hot and cold rose at night, unhealthy gums, excessive saliva, murk salt 200C 3 times a day. Easy and passing bleeding blood, do not. Phosphorus 200C 3 times a day. Excessive bleeding from gums, hot and sore bleaching. Salicylic acid 30C 3 times a day. Oozing of thin blood gums, swollen, spongy, sensitive to touch, bleed easily, rose at morning. Lexis 200C 3 times a day. Gums reacted and bleed easily. Carbovage 6C 3 times a day. So now I want to talk some gums, spongy, bleed easily, cries of teeth, cariazotum 30C 3 times a day, ulceration and bleeding of gums, offensive breath gums, unhealthy, sensitive to hot and cold water, murk salt 200C 3 times a day, gum, abscesses due to decayed teeth or otherwise, Hecla lava 6x 3 times a day, inflammation and throbbing pain in the gums with hot feeling, belladonna 200c 3 times a day, bleeding of gums rose morning and pressure gums purple in color, laxis 30c 3 times a day, ulceration and bleeding of gums, blood to knot, phosphorus 30c 3 times a day. Now I want to talk some single remedies which we are common use for toothache. Better by sweat pain, extend to ear, temple and cheekbone, chinopodium 30c 3 times a day. Better holding cold ice water in the mouth, rose by heat and hot fluids. Coffee croda 200c 3 times a day. With restlessness, better holding cold water in the mouth, rose by warmth. Pulsatilla nigra 200c 3 times a day. Rose dipping hand in cold water, washerwoman's toothache. Phosphorus 200c 3 times a day. Due to decayed teeth, very rapid decay of teeth, of milk teeth, Cariazotum 200c 3 times a day. Pain extending to ears, sensitive to touch, teeth feel too long, Plantago 30c 3 times a day. Severe pain at roots of decay, teeth rose by pressure, pain extending to eyes, oversensitive to touch and cold, Staphysagria 200c 3 times a day. Due to inflammation of decayed tooth, rose at night, cold and hot applications. Merc salt 200c 3 times a day. Severe pain, better by cold open air, sucking teeth. Allium cepa 30c 3 times a day. Rose by eating, drinking cold water, night, curious, hollow teeth, antimonium crodum 200c 3 times a day. Rose tucking anything sweet, nectarum carb 200c 3 times a day. Rose after loss of vital fluids while nursing the child. China 30c 3 times a day. Intolerable radiating to ears and face rose by warmth and drinking coffee. Chamomilla 200c 3 times a day. Toothache due to pyorrhea. Carbovate 30c 3 times a day. To checking bleeding after the teeth, falling of teeth, and also to reduce pain due to filling. Arnica 200c 3 times a day. Throbbing pain with dry mouth, gum boil. Belladonna 200c 3 times a day. Teeth and gums very sensitive to touch, bleed easily. Pepper sulf 200c 3 times a day. Toothache relieved by heat and hot fluids during teething in the children. Magnesia fars 30c 3 times a day. So now I want to share some protocols which I commonly use in my clinical practice. So first protocol is for toothache. Ferrum fast 6x, Calcarea floor 6x, Silesia 6x, mix together and use 3 times a day. I repeat again, Ferrum fast 6x, Calcarea floor 6x, Silesia 6x, mix together and use 3 times a day. Okay, so second one, if teeth pains in cold weather, then we are use Aconite 1 m. Aconite 1 m. We are repeat 2 doses every 10 minutes until pain goes. So my second protocol is for toothache. Aconite 200C, Belladonna 200C, and Calcarea Flow 200C. Mix together these two remedies and use every 10 minutes until pain gone. So third line protocol is also we are used for toothache. Cariazotam 200C, Arnica 200C, and Kali Sulf 200C. Mix together these three remedies and use 3 times a day until pain gone. So next protocol is for gums bleeding. So first remedy is Merc salt 200C and Soranum 200C. Mix together these two remedies and use 3 times a day. Second protocol is Carbovage 200C and Kali Fast 200C. Mix together these two remedies and use 3 times a day. So these are all what I have. So next I request to our second speaker talk about this topic.
Hi there, everybody. Thank you, Dr. Imran. My name is Angela Babb. I'm from the United States in the Northwest Georgia area. I'm going to list some possible remedies for abscesses in gingivitis in specific. But first, since we're talking about oral care, I thought maybe I would share some suggestions for oral care. Oil pulling. It was just a couple years ago that I first learned about oil pulling, but apparently it's supposed to help in removing toxins, not only from the mouth and the gums and between the teeth, but also from the body, because our teeth are connected to different parts of the body and different organs of the body. So oil pulling can actually help draw out toxins from the body altogether, not just from the mouth only. They say that you should do it at least 2 or 3 times a week, but if you can do it more, I'm sure it would just be that much more beneficial. You can use different types of oils. I personally like using the organic, unrefined, cold-pressed coconut oil. Start out using as much oil as you can. Usually you have to start out kind of low, maybe half a teaspoon. I think they want you to work your way up to like a tablespoon. Swish it around in your mouth for as long as you can. If you find that it's painful, you're probably swishing a little too hard. Maybe it's just a gentle swish. You just want to make sure that's kind of going in between your teeth. And make sure you spit it out in a trash can or outside in the yard. Don't spit it down your drain because it could possibly clog it. And the more you do it, you'll find that you'll be able to increase the amount of oil that you can use and also extend the amount of time that you can do it. I think they say usually to do it, try to do it for 2 to 5 minutes. I've seen some people that do it even up to 15 minutes. Now there's lots of questions about toothpaste. I come across that a lot. Everybody's always asking, what type of toothpaste do you use? What do you prefer? What do you recommend? But in my research, I have found that there are some certain ingredients that you should definitely avoid, in my opinion. Fluoride. because it's toxic and it actually calcifies the pineal gland. Glycerin is one that you should avoid because it actually creates a thin film over your teeth. And if you're trying to remineralize your teeth, the glycerin is actually going to prevent that remineralization. And another hot topic right now, it's all the rage and all the natural toothpaste and everything, is hydroxyapatite. Also nano hydroxyapatite. But in my research, because it is fairly a new or a fairly new ingredient, my research, I have come across this information about hydroxyapatite and nano hydroxyapatite. It's actually quite literally the natural version of fluoride. It crosses the blood-brain barrier, calcifies the pineal gland, it increases blood calcium, creates crystals in the joints, ends up in the lungs and creates an inflammatory response, damages kidney tissue, and kills liver and kidney cells. And that's just to name a few things that I found out about it. But again, it's new, so you can, I had a lot of stuff that had nano hydroxyapatite in it, and I threw it all away when I came across that information, but that was my choice of my research. So there's some information for you. Okay, so let's talk more about remedies specifically for abscesses. Now, I'm just going to list some remedies. It's not going to be the potencies or the dosages. It's just going to be some possible remedies. I went through my Robin Murphy's Meta Repertory 4th edition, and under mouth, starting on page 1603, and also teeth, starting on page 1967, I found these remedies, like the top listed remedies. And I also searched the internet and looked for combinations or complexes, or maybe different websites and what remedies they recommended. So for abscesses, the first one is anthracinum, and it's actually been shown to cure abscesses. Burita carbonica, and it's good for quinsy, which is paratonsillar abscess, and separating tonsils. I guess every time you get a cold, you get separating tonsils, that pus in your tonsils. Belladonna. Belladonna, best for early dental abscess accompanied by redness and throbbing. Borax veneta, borax.
I don't know where it is from. I'm going downstairs.
Painful gum boils, which a gum boil is an abscess on the gum. Calendula has abscess in its picture. Causticum. Causticum is good for recurrent abscess in gums and dental fistula. So a fistula is a canal that forms when an abscess has nowhere to drain. China has abscesses in its picture. Echinacea has abscess in its picture. Floricum acidum has abscess, dental fistula with bloody, salty discharge. Gunpowder, shown to cure abscesses, specifically gum abscesses. Hecla lava, gum abscess, dental abscess with swelling, chronic dental or jaw abscess, fistula, and gum boil. Hepar sulph, shown to cure abscesses and the tendency for chronic abscesses. Creosotum has abscess in its picture. Lycopodium has gum boils in its picture. Mercurius, of course, that can be Merc Viv or Merc Sol. They're usually interchangeable. Gum boils. Alveolar abscess, which is located in the alveolar process of the jaw. Mira is shown to cure abscess and dental problems. Nux vomica, gum boils, which seem about to burst. Phosphorus, abscess of the hard palate and gum boils. Plantigo major, shown to cure gum boils. Pyrogenium, shown to cure abscesses, abscess of teeth at the roots. Ruta, shown to cure gum boils. And Silicia, shown to cure abscess, abscess of the root of the teeth, and abscess with swollen glands. And you heard Dr. Imran mention many of those remedies and give protocols for them. Now, let's also give a list of possible remedies for gingivitis. Found this information in the same place of the meta repertory on in mouth and teeth. And I then went through the Materia Medica and just looked for these specific symptoms for these remedies. So for gingivitis, aconite, gums are hot and inflamed. Alumen crudum, the teeth get loosened from chronic gingivitis. Alumen can strengthen the tooth holding structures in the mouth to provide the teeth a firm holding. Arsenicum album, unhealthy bleeding gums, or unhealthy bleeding gums, swollen bleeding gums, painful to touch, gums painful to touch. That was a duplicate. Belladonna, painful swelling of gums, bleeding of gums. And again, some of this information I found on some websites, the different homeopaths that I found online that I came across when I did this research for this. Borax is good for bleeding gums. Calc fluor, good for dental problems, I guess in general. With loose teeth where the gums are swollen and inflamed, teeth get loose in the sockets from long-standing gingivitis. Calc fluor can strengthen the tooth holding structures in the mouth to provide the teeth a firm holding, much like the aluminum crudum. Calendula, bleeding gums. Capsicum annum is good for when gums are hot, spongy, and retracted. Carboveg is good for when blood oozes from gums when cleaning teeth. Gums are retracted and bleed easily. Gums can be black in color. And pyorrhea, which is periodontal disease, gum disease. China, or Cinchona officinalis, for gum disease or for gum tissue that is bleeding and swollen gums. Echinacea, gums recede and bleed easily. Ferrum phos, for poor gum tone or gums that bleed after brushing, bright red bleeding of teeth and gums. Gunpowder is good for pyorrhea. Hecalava is good for chronic gingivitis. Hepar sulph has gingivitis in its picture, gums and mouth painful to touch and bleed readily. Hypericum, good for tender gum tissue and to promote healing. Creosotum, gums are painful, tender, protruding, and puffy with intense swelling. Spongy bleeding gums, gums are bluish. Gums are bleeding of gums with dark blood, quickly coagulating. Protruding gums infiltrated with dark watery fluid. Lachesis, bleeding gums, gums bluish, swollen, spongy, bleed easily. Lycopodium, gums bleed when touched or cleaning teeth. Mercurius corrosivus, good for pyorrhea. Gums are purple, swollen, spongy. Gums are red and detached from teeth. Gums bleed easily. Merc Sol or Merc Viv, shown to cure gum disease or show to cure gum disorders. Sore gums, mucous membrane bluish red and spongy, painful, ragged, swollen, bleeding gums. Gums are spongy, recede, bleed easily. Muriaticum acidum, gums are swollen, bleeding, and ulcerating. Mira, shown to cure gingivitis and gum disease. Nitricum acidum, gums swollen, sore, flabby, gums bleeding inner side on the inner side, gums soft and spongy, gums red and enlarged between teeth, gums are white, swollen, itching on gums, and bleeding of gums. Nux vomica, gums are swollen, white, and bleeding. Phosphorus, bleeding gums, gums are sore, painful, and tender to touch. Pain in gums gets worse from cold and heat, and also while eating. Persistent or chronic bleeding. Plantigo major, shown to cure pyorrhea. Gums bleed easily. Silicia has pyorrhea in its picture. Gums are swollen and painful, sensitive gums. Staphysagrium, pale, spongy, bleeding gums. Pyorrhea, gums painfully sore. Gums white, swollen, ulcerating. Gums bleed when pressed upon and upon cleaning the teeth. Symphytum has gingivitis in its picture. Ruta, it's good for when gums bleed easily. And the last one is thuya. Gums are very sensitive and retract. Pyorrhea alveolaris, gums swollen, inflamed, and dark red. And that's all of my list I have for you today. Thank you.
Thank you very much, all of you. Next Sunday, same time, we meet again here. And I want to say again, thanks to everyone and God bless you.
Thank you, Dr. Imran, and thank you, Angela, Bob. We appreciate everything that you told us today. Very informative. Thank you again.
Thank you very much, God.
Thank you, Vivian.